Cancer, once a daunting diagnosis, is now a battle we are winning, manageable and even curable. This shift is fueled by breakthroughs in research, cutting-edge therapies and smarter diagnostics. Cancer care has seen remarkable advances in recent years, from precision medicine and immunotherapy to surgical innovations and early detection technologies. The question before us today is whether these breakthroughs have truly shifted the paradigm. Are we still treating cancer, or are we beginning to cure it? Our expert panel will discuss the current state of cancer treatment, emerging therapies, and the future of cancer care. Today we have with us Dr. Nitesh Rohatgi, Principal Director, Medical Oncology, Fortis, Gurgaon. We also have with us Dr. Vinay Samuel Gaikwad, Director, Surgical Oncology at Fortis, Manesar. And joining us as well is Dr. Amol Balwant Akhare, Senior Consultant, Medical Oncology, Fortis, Mumbai. Well, it's really a pleasure to have you all with us today at the NDTV studio. I think to begin with, Dr. Rohatgi, I want to ask you, if early detection, when we talk about the preventive approach, right, if early detection is the strongest path to cure, why is it that India as a country, we are still relying at screening?
I was once asked a question, if I had to put £1 million during my interview, where would I put as a trainee? And I had rehearsed that answer, and the answer was prevention. Next $1 million, prevention. Next $1 million, prevention.
So that is the key.
It is.
Yeah.
Now, the problem with prevention in cancer is we don't know exactly all the causes. But we do know some causes. We know smoking, for example, is the biggest modifiable risk factor. So if we can really stop smoking, it's same as prevention. We know that HPV vaccination decreases risk of cervical cancer. So that's another prevention. We know obesity, exercise, processed red meats. So decreasing all of that is prevention. But the key change that has happened is early detection. And not only early detection, structured early detection. Why has India not adopted it? Because I think we are in the process now. You know, we have taken the last decade, 2 decades to start saying this is at the center of our health. This is the key problem we are facing. We need to do something about it. Plus technology is changing. Your mammograms are easier. Your blood-based detection is getting right, you know, it's at the doorstep. So we will see a lot of changes. There's a lot of communication, a lot of talk, and I'm sure that this is the beginning, and that's why we haven't seen that.
So I think like you rightly said, it's also about being mindful of the actions we take from a preventive perspective, but a lot more happening on the other side as well when it comes to early detection, of course.
And talking about it. And I say that again and again. I feel very good when I'm going and speaking to class 10th and class 12 students, because they go and speak to their entire family. You know, so we need to talk more about it in society, not just on the WhatsApp and on the Google pages, but actually we need to talk person to person, HI to HI, not AI to HI.
Yeah, person to person. You will keep that going. Okay, no, thanks for that, Dr. Khare, again, because like, you know, Dr. Nitesh just said, it's more about early detection. Of course, prevention is key. So when we, I was researching this multi-cancer early detection, which is MCED. These are being called the future of screening. And when obviously when we talk about early detection, screening plays a key role. How close are we really, as a country again, are we using that? And when it comes to accessibility, what are the challenges? When it comes to affordability, tell us a little bit about that.
So, as you rightly said, the screening was previously limited to pap smear or mammography for cervical and breast cancer respectively, and for maybe stool for occult blood or PSA level in males. But now, as the technology is evolving, these tests are also evolving, and now we have something called as multi-cancer early detection tests. These are blood-based tests. Of course, it is not yet perfect. There are a lot of studies going on. There are a lot of studies going on in UK and US about this. So a simple blood test they can test for certain genes, and to tell you, especially if you have a very high risk of family history of cancer, then they can detect whether you are prone for certain cancers. But as you said, whether it will come to India so early, yes, it is at the doorsteps. It required more data, more research, but maybe 5 years down the line, or maybe 7 8 years down the line, if you're doing this show again, that time maybe we'll be talking more about them. But that is where the future is going.
Hopefully we won't wait for 5 to 7 years, and we do a lot more and bring that awareness a lot more before.
But to be fair, we may have to, because you really need good statistical medical validation before you use
jumping
it.
into something like that.
It was only last year, 24, when the world's first blood-based cancer detection was approved by FDA. Right?
Yeah.
Only a year ago. So now you will have a lot more coming and a lot more happening.
A lot more coming and a lot more quicker. And that's
Of
why I
course.
want to ask you, Dr. Gaikwad, again, AI. We've spoken about technology, we've spoken about screening. How much do you think AI, artificial intelligence, can help predict if somebody is going to have cancer?
So I'm a believer in AI. And as we speak, every day, a lot of advancements are being made in the field of AI, especially in healthcare, and more importantly in cancer and its prevention. So when we come to predictive models regarding the detection of cancer, like what is my risk of developing cancer in my lifetime? That's what the million-dollar question is.
Yes.
So there are predictive models that can kind of integrate the various factors. Let's say smoking, as Dr. Thug said, smoking with family history, with maybe environmental factors. So how do all these various factors interplay with each other? So that's the model that we're looking at. Obviously, it's not validated, but like he said, very soon in the next few years, we expect AI to come in a big way to help us understand our risk of developing cancer.
Yeah, so also, AI, technology, innovation, all this work will play an important role.
Absolutely.
Okay, yeah.
And it helps us detecting imaging, screening imaging much faster. It helps public health authorities decide how to approach various situations when it comes to cancer.
So the screening will become individualized with the help of the AI.
Yeah,
That's
in fact, not that one fits all. In fact,
Yep.
I have a question on that. Dr. Nitesh, I want to ask you, we've spoken about AI again, and you've spoken about early detection and the importance of it. Early detection, the role that plays versus the new age therapies. There's so much out there when it comes to cancer, and I think that's why I had also used the term cure, because people have faith that they can be cured.
So I think they go hand in hand. I think one should not make the error of believing that AI will solve this, because unless we put in enough data, it will not be able to be good AI. We cannot say if you detect everybody as stage 1, people will be cured forever. And you can't say that precision medicine, which is also at the helm of this AI and the technology detection, will solve this. So it's actually everything. You need to pick up cancer early. You need to find more affirmative ways of curing it, finishing it. You need to find ways of measuring, have you cured it or could it come back? And then you need to find ways of actually saying, if you haven't, what do I do more? Escalating therapy to snap that. This is the thought process which is in action today and will be the future tomorrow.
Okay, so that is the future tomorrow. But again, Dr. Gaikwad, I want to ask you about screening. Right? Again, screening is important when it comes to early detection. What are the cancers that can be prevented if they are screened well in time, and how does that process really work?
So prevention, I think, would be limited to just 2 cancers, colorectal cancers and cervical cancer. The rest, breast cancer, head and neck cancers, all the other cancers, we can detect these diseases early. The reason I say that is colon cancers, you can detect these polyps, which can be then removed colonoscopically without any major surgery, and therefore preventing that polyp from transforming into a cancer later. Similarly with cervical, with the pap smear, whatever it might be, we can actually detect pre-cancerous lesions which are not yet fully malignant.
And similar with mammography, I mean for breast cancer?
It is similar, although
but not,
we can
it's
only,
not sure shot.
Yeah, it's not very sure shot, but yes, it's at the verge. So I think, yes, it's very useful to screen for breast cancer as well.
For the ones we know, okay. Yes. Dr. Khare, I want to ask you, we've spoken about again, the science and innovation technology. Genomic profiling is changing again, how we diagnose and treat cancers. Tell us a little bit about that, but again, look at our country, how diverse we are as a nation. Again, what are the challenges when we talk about affordability, we talk about accessibility, when we talk about reaching to the masses, last mile connectivity, where are we on that?
So it's a very good question, because ultimately what matters is whether can we do it in India. And as you know, our biggest problem, if you say it is a problem, is our population, 1.5 billion. And the way we are growing, probably in next 10 years, we'll have, by sheer numbers, maximum number of cancer cases in the entire world. And that is not the one problem. The other problem is that they say in every 100 kilometers in India, the language changes. so the ethnicity changes.
Yeah.
So we have mixed ethnicity people. So if you wanted to have this genomic profile or the screening based upon the genomic thing, then we'll have to have first a genomic registry. We'll have to include all the ethnicity people. So it's a gigantic task. But good point is that a lot of people are working on it. And positively, I will say that we will probably have these kind of data sets for every ethnicity sooner or later, and that will definitely help us.
So
But
a lot is on data, a lot is
yes,
based on
I
data.
can add to what he's
Sure.
saying. We will also, and I'm very proudly saying this, we will also be the world's most robust and the cheapest
Correct.
genomic
Okay.
testing
Correct.
with very high quality. We're already seeing what's happening. We're comparing it to the world. I think
So we will be taking
India is
that
far
there.
excellent at it.
You know, that's amazing to hear that when we have, experts like you all, of course, working towards something which is so important and critical. Dr. Rodke, do you think we are focusing a lot more on treatment advances and little on prevention and early detection? That's something again. Are we always like looking to treat kaise kare?
As true as you are, and you're absolutely right, we are focusing a lot, but it is also the need of the hour. You cannot give confidence of that word cure till you have seen somebody go through it in your backyard, in your office, at your home. And that leads to the question of, should I prevent it? So you do need confidence that the therapy today will be aimed at trying to get majority of patients rid of cancer, even if they are in slightly more advanced stage. We never used to see a kidney cancer patient with stage 4 disease live beyond 6 months. Now we are seeing them 7 years, 8 years later. Not all of them, but you're seeing them 7
So
years,
the
8 years later.
confidence versus the fear.
And we need
So faith
both.
over fear, I would
Yes,
say.
and only when we have confidence, lack of fear and faith will you say, let me detect early. It's a psychological shift. It's not just a technology shift.
I think you're absolutely right. Treatment along with, of course, prevention, early detection. On that note, we're going to be taking a really short break. You're watching Preventive Edge, an initiative by Fortis Healthcare in partnership with NDTV. Welcome back. You're watching Preventive Edge, an initiative by Fortis Healthcare in partnership with NDTV. And we're talking about curing cancer, not just treating it in 2025. But a question again here is on the preventive aspect. And Dr. Gaikwad, I want to again come to you here. If one leads a healthy lifestyle, I think a lot of us would want to know this, can one still get cancer? Or how can I avoid getting cancer in today's day and age?
Unfortunately, there's a misconception that if I lead an extremely healthy lifestyle that I can prevent cancer, and that is not true, as I see in my practice, especially as a GI surgical oncologist. Many cancers are absolutely, you can be a yoga instructor, be absolutely healthy, lean, body mass index, everything, and still develop cancer. And those are the patients that really feel upset and depressed about the fact that they've done everything right, and yet it happens. But yes, leading a healthy lifestyle is a very important factor. Avoiding smoking, not drinking, having a good weight and exercise, avoiding red meat, processed meats especially. But despite all of that, we can still...
so it's not a guarantee. It's not that if all the tick marks are there, you still can get cancer.
We're all at risk.
If I put it together, a lot of factors come together to cause cancer, big one being luck, bad luck. And a lot of factors come together to prevent it. You increase your good factors and hope for the best.
Pray for the best.
Pray for the best.
Okay, the other thing I want to ask, I think Dr. Khare, is about how soon can ctDNA become a routine tool in India for detecting minimal residual disease and also early relapse in cancer, which Dr. Nitesh was saying, we often see it. And what are again the practical challenges in terms of the cost, the accuracy, as well as the clinical adoption?
So the ctDNA is an upcoming test, and as compared to MCD that we discussed previously, ctDNA data is more robust, at least in certain cancers like colon cancers and sometimes in breast cancer also. So it detects very minimal residual disease, something that cannot be picked up by routine imaging, including the PET scans. So a lot of us in our practice do that, especially for colorectal cancers or breast cancer sometimes. But as I said, the data is evolving, the test needs to be standardized, and we required good labs which can give those results faster. But as I said previously also, India is slowly getting into that, and we are having, in fact, Fortis also has in-house labs where we can get the ctDNA results which are more sensitive and specific.
We've spoken about patients, we've spoken about what the healthcare is doing, what innovation technology, but I think something very critical here is when we talk about, we're sitting in, end of 2025, when we talk about the role of policy, the role it can play in actually improving the rates, curability in cancer.
That's a very, very, very critical point. And I do feel let down that our policy and advocacy remains possibly the lowest or smallest silo in this. And then a part of that is we have so many health problems and so many health problems. So I can't really fight on that. But, we are not really looking at policy in a structured way and say, what's our policy on prevention, on early detection, not smoking, rare cancer. We have possibly the largest amount of under 50 cancers in the world. We have seen so many young women, non-smokers with lung cancer. It's unbelievable. And we are not yet agreeing that there is something odd here. We need to look at it separately. We're not innovating oncology for our patients. We are not trying to say, why did this group of 200 patients, put them aside. You ask 10 of us, we'll give you 5 patients each. Put them aside, do some cutting edge research. What is different in them as the 20 patients in Boston? Do some of that work which institutions like Tata are trying to do or IITs are trying to do.
So policy you think is a gap which needs to be worked upon.
Because you're not thinking about it.
Yeah, so that is something which needs to, because that's a very, very relevant point. But again, Dr. Gaikwad, you'd spoken about certain cancers which can be screened for. I want to ask you about a specific cancer which is called colorectal cancer, and we see that the numbers of cases in India are going. Why? What are the factors? We see this cancer number increasing, and what can be again done? Is there something that we can prevent colorectal cancer?
It used to be a Western disease, so we thought it was in the US and in Europe, but because of the westernization of our country as well, urbanization, we're seeing very young patients in college and even before that developing colorectal cancers, maybe because of diet factors and also environmental factors. But what we're seeing is alarming, and the what we call the prognosis or the outcomes in younger patients we know is far inferior to elderly patients because of the tumor biology. So colorectal cancers is slowly climbing up the ladder, so to speak, of cancers in India as well. So it's a big concern because of genetics, hereditary factors, that is, as well as lifestyle changes, which we are seeing more often now.
So the number is going up, and still awareness, again, I'm guessing, is less on this, right?
It is. Okay.
So I'm glad we're talking about it. Again, I want to ask.
One of the important points is that the amount of junk food that we're eating, and we are moving away from our normal diet, the normal breakfast that we used to have maybe 20 years ago when we were small. That is going away.
The healthy traditional Indian breakfast.
Yes, you're missing our roots, and if we go back to our roots, including our traditional food items, probably some of the problem in the younger generation getting these colorectal cancers will go down.
So again, coming back to lifestyle, I think it ties back to where we started. I mean, somewhere we have to be more mindful towards that. Dr. Gaikwad, I want to ask you, Dr. Khare, I want to ask you about precision oncology, is growing again. Do you see that as a future when it comes to cancer care? Like, you were also talking about that shift, that rather than one size fitting all, more personalized. So prevention through genomic and risk-based prediction. And what are the limitations of this approach?
So preventive oncology includes precision oncology, and precision oncology is of course well established nowadays for treatment. So if you say lung cancer, there must be 15-20 types of lung cancer based upon which gene is present, and there are medications available, say for EGFR, ALK, KRAS, NTRK, a lot of genes can be tested, and that is improving the outcomes. See, all of us must have having patients with stage 4 lung cancer living for 4 years, 5 years, 6 years. So definitely in treatment part, precision oncology is already established. Now we are talking about in prevention, can precision oncology play a role? So yes, that is happening. But for that we need to know our genomic profile. The Indians, because we are, as I said, we are a very vast country. Say for example, gallbladder cancer is much more common in North India, but not in that common in South India. So we need to study all those factors, find out what are the genomic profile of those patients, and we are doing that. A lot of institutions are working on it, and probably sooner or later we'll reach there to utilize the precision oncology for prevention also.
For prevention also, because that ultimately is the key when we look at reducing the numbers.
And he makes a good point that actually it is tied together. They're not two different things. You're precisely knowing where individual groups, families are having problem is precision oncology.
That's where we need to work on. Okay, if I can ask you, of course, thank you for sharing such important tips, in fact, as well. I think, even for our viewers and with somebody who's suffering or going through the treatment. Dr. Nitesh, looking ahead, what breakthroughs are you excited about? Because you use the term and you were very happy with the term we used when we put cancer and cure together. But when we look at that, what really excites you when we talk about medical oncology coming in the near future?
Yeah, if you have about 48 hours on this program, I'm very happy to talk about that as well.
In short.
But if I had to pick two, I would say blood-based early detection, which I think in about 3 to 5 years will become standard. We'll be doing tests every year, picking up stage 1, stage 2 tumors. And second, very interesting, is something called antibody drug conjugates, where chemotherapy at a much higher dose, 8 times, 10 times, will be delivered only to the cancer cell. So tumors that are left behind will get a much higher dose, and I can see how that alone will change the curve of curability in the times to come.
Great. Well, would you like to add anything, or how the youngsters are now, when you said, people under the age of 50, many of them have cancer, how they deal with it? Are they missing out somewhere, or would you like to add anything? What do you think when we're talking about cancer and curing it? What could be the way forward?
I agree with Dr. Nitesh that the two things, that is the multi-cancer early detection test as well as the screening, will become easier. And of course, there are treatment options like ADCs, and in fact, there are some like CAR T cells, and all those things are coming out. What is more important that is happening nowadays, as you said rightly in the beginning, that we are talking about it. We are talking about it, we are doing such programs. So people nowadays are less afraid to talk about cancer. They're less afraid about doing the test. They see patients who are doing well, and then they see that the fear is slowly going down. That particular thing is probably the change. And that is what I think is a good thing.
That is the right, And last word to you.
Yeah, so I think more of us are starting preventive oncology programs, including our hospital, so that we can actually, like you said, rather than wait for it to be detected early, can we find out, people are inquisitive now, do I have a risk of developing cancer? They want to reach out to us clinicians
that well
to
in
understand
time if you can find out.
So there are many tests as discussed today, and so I think that should be the focus, and integrating AI into all of this, the whole gamut.
The term there is FOFO, no? Fear of finding out.
So we need to overcome that, the FOFO. I mean, it's not just FOMO, but it's about FOFO. That's a new term I've learned. Well, it's really been a pleasure to have all three of you here with us today. Thank you so much. So cancer care in 2025 is not just about treatment, but about hope for cure. We've just heard how science, surgery, and innovation are reshaping possibilities. Meanwhile, let's really hope that those battling cancer overcome it, and that breakthroughs in treatment and care continue to improve outcomes. Here's to a future where cancer is a manageable and ultimately curable disease. Thank you so much for watching.